All right, we are back with episode 57 of Modern Prescription. My name is Dr. Deepak Dugar.
And I'm Dr. Jeff Toll.
And today we have a great episode of Your Husband Got Me Pregnant.
This is a great episode. Basically, we have on Dr. Ghadir, who's a fertility expert. Mm-hmm. And we talk about how to get pregnant, how to not get pregnant.
How guys can help increase their fertility, what girls can do for their fertility. What is freezing your egg? What does that mean? How does it work?
I personally learned a lot. Very informative.
Oh my God, great episode. But before we get into Dr. Ghadir, there's a lot of crazy stuff going on with vaccine mandates.
Yeah.
You know, we don't even have to talk about the vaccine. We got to talk about these mandates. So the state of New York passed a law that anyone in the healthcare industry, nurses especially, were targeted, who are not vaccinated are fired effectively immediately.
Right.
And so there's, a lot of hoopla about this. Of course, it turns out the numbers you look at, it's about 5,000 healthcare workers, it looks like, were actually let go.
Yeah.
So what are your thoughts?
I've been following this very closely on social media. I know healthcare workers who are in all sorts of parts of the country through social media and stuff. And, to me, it's shocking that as a healthcare worker who's worked during the pandemic, especially in New York, who was really badly affected, a lot of people are complaining, I've been taking care of patients this whole pandemic and now you're going to fire me because I don't get the vaccine. My first response is just being shocked that someone taking care of patients this whole pandemic, watching people dying, wouldn't get the vaccine because it's incredibly safe and they have no reason not to get the vaccine.
Right.
But beyond that, I think, I had long been thinking about why the federal government had not mandated it and why has all these governments not mandated it. And I think the reason is the governments are worried if they mandate it, they're going to lose their workers. The government will cease to function because
a lot of people
are too uninformed to get vaccinated and there won't be enough people to functionally run the government if they do that.
Right. Yeah, I'm sure they've studied this. I think that they want to, I think personally, it's a little harsh to let people go. But I also agree with the other side that it's very ridiculous to me that if you're a healthcare worker in New York, of all places, that you wouldn't get vaccinated.
The thing is, healthcare workers not only need to set the tone for everyone else. So from that standpoint, they should be getting it.
Yeah, it's almost like a code of conduct, professionalism.
No, yeah, and they put their own patients at risk
by being unvaccinated. Yeah.
And so by being unvaccinated, they're putting their patients at risk, and so that's really the thing that is not okay. And I've encountered this myself, where I've had doctors applying for jobs who either have some sort of religious exemption for the vaccine,
which, by the way, you just have to write the word religion.
Right,
and there's actually no paperwork.
I was wondering when COVID was mentioned, the COVID vaccine was mentioned in their religion, because
the medical mandate, if you have a medical excuse, you actually have to have legit paperwork from a doctor, sign,
and so
stating why you can't get it, and for how long you can't get it.
And
religion, you just write the word.
So the medical exemption thing would tend to be something like, I had a terrible reaction, like Guillain-Barré syndrome, so a flu shot.
Or some crazy autoimmune stuff.
Autoimmune stuff or blood clot. There's something maybe, but...
Yeah, but that a doctor would have your back.
Yes. And documented that these things happen.
Yeah.
You can't just check a box that says medical exemption.
Right.
So what's crazy is I'm a big sports fan.
Yeah.
And this is now affecting the NBA, where one of the most famous players on the New Jersey Nets, or now the Nets... Brooklyn Nets, excuse me.
Yeah.
Brooklyn, New York. Should have realized that. Kyrie Irving basically is saying so far that he hasn't been vaccinated.
Right.
And there's another law in New York, also New York taking the lead on a lot of the, COVID-related mandates.
You must be vaccinated to be indoors.
You have to be in a stadium of that size, you have to be vaccinated.
Even a restaurant, you have to be vaccinated.
And so now they're favored to win the title. They have, Kevin Durant, they're a really good team. And this guy's making like $35 million a year. And as of right now, he won't be able to play in home games.
Wow.
And so, it's really crazy what these, because the government is not, the federal government's not doing anything. And it's up to these like local leaders to decide what's going on, and then it's affecting businesses. So it's really
right. Yeah, here in California, we have a mandate as well that everyone has to either have a religious or medical exemption, and if they don't, they have to do weekly or sometimes twice a week COVID testing starting today, as of September 30th.
To go where? In what places?
For as a healthcare worker.
As a healthcare worker.
Yeah. So anyone working in any healthcare setting has to either have the vaccine or has to have twice weekly, sometimes once weekly, depending on the type of care.
Did you find you got some pushback when you were asking your employees to get the vaccine?
Thankfully, most of my employees wanted to and got it significantly
early.
A long time ago. Yeah. But a few definitely took some time.
I had some holdouts.
Yeah.
I was shocked. I was really shocked.
But I've definitely learned that the one thing is it's better to get it late than never. So I'm still hopeful and still hoping that people realize it's not as big of a deal as they thought and just get it if you haven't.
And I'm hoping for the people who are hesitant that they have learned that now we have more data. So like if you were hesitant,
so much data.
If you were hesitant, it's a new vaccine, it just came out, I'm not sure. Fine. But now, some people are close to a year out from getting it. I got it in December now. So we're 10 months out. And we've seen hundreds of millions of people get the vaccine now.
Right.
And so the risk-benefit ratio is very clear.
And one thing I want to say, because I follow some people who post a lot about anti-vax stuff by accident. I don't know why I follow them anymore. But they post a lot of stuff about do your research, do your research. And it's all about like how much research they do. And I just want to say like, if you really want to make a change in life, like this is what they say about government, right? Like, dude, it's easy to criticize the government. Become a politician, run for office. So do your research. If you really want you to do your research, go to medical school. Yeah. Like, go to medical school, go for 4 years, do medical school, do residency for 4 to 10 years, and then become a physician. And then you tell me after that whether or not you think we should get the vaccine. Right. Then I'll actually listen to you, right? But if you look at the actual physicians across the country, 99% of them are vaccinated and promote the vaccine. I agree. There's always going to be some weirdos, but most of them are very, very stern about this.
Agreed. And on that note, I think people really want to hear about this whole fertility issue.
Yeah, let's bring in an expert on fertility. So just like experts on everything else, expert on fertility.
There you go.
Dr. Shahin Ghadir, thank you for joining us. All right, we are back with Dr. Shahin Ghadir, who is a fertility expert here in Beverly Hills, takes care of a lot of the celebrities in town, and is going to share a lot of myth-busting today about fertility.
Maybe he can explain why I don't have children.
I think your mom wants to talk to him a little bit more detail about that. Well, thank you for being on. We really appreciate it.
Thank you so much. I'm really excited to be here today.
Yeah, so tell us a little bit for someone who doesn't understand what a fertility doctor is. What do you do for a living?
So the official title is reproductive endocrinology and infertility specialist. What that means is that any kind of hormonal abnormalities that may lead to reasons why people are not getting pregnant, that's under our category of treatment specialty. And the majority of what we do is fertility. So the infertility part, I don't like to say the word infertility. I think it's better to say fertility because most people walk out of my office fertile. Give it a little positive spin there.
I like that.
So, help is not infertile. He is a fertility patient of the future. So it's one of those things that we definitely, we help people who are concerned about their current state of not being able to get pregnant, but we also help people that are concerned about their future plans for conceiving, fertility preservation, fertility freezing, egg freezing, embryo freezing, for couples, for individuals, are a big part of our practice. We have a large segment that's called third-party reproduction. That's anyone that needs to use an egg donor, a sperm donor, or a surrogate. So a lot of our gay couples, our lesbian couples, our single individuals, people that just don't want to carry a pregnancy, all of those fall into third party. And we have one of the largest third party divisions of all the fertility clinics in Southern California. So we're doing a lot of fun stuff here.
Wow, amazing. Very cool introduction. And famously, you just helped Lance Bass and his partner with fertility as well. Is that correct?
Yes, Lance and Michael have been my patients for a bit. And we had a great opportunity to finally celebrate on my podcast and go over everything. A lot of myths and people saying a lot of things about their whole journey that we put to rest. And they're both great guys. And we're going into October tomorrow. And hopefully they're going to be having babies real soon. And they've done unbelievably well so far.
Awesome.
Wow. Yeah, next
so
generation.
Obviously we want to jump into all sorts of this stuff. And I think maybe a good place to start is, so if you and your partner are trying to conceive and are not having luck yet, when do you think is a good time to start questioning whether or not there's some sort of fertility issue? How many months or so should someone start to wonder is there something?
Is how much sex they're having a problem too?
Sometimes, one of the first thing to go off of a list of couples that are really trying is like their sex life. So the second you've got to become a machine and turn on the switch, it's like, okay, well, for the first time, the switch isn't working. Secondly, any couple who like really needs to have sex on demand, like I see people that are like, we have sex 3 times a month right around ovulation. And then like, we don't even talk to each other the rest of the month.
Wow.
So that's always not a healthy thing. The American Society of Reproductive Medicine likes to say that if you've been trying for 1 year to conceive, and you are under the age of 35, by definition, that is the diagnosis of infertility. After the age of 35, trying to conceive regularly for 6 months gives you the diagnosis of infertility. However, I have to tell you, it's not so black and white. If you have incredibly irregular periods and you are 29 years old, well, guess what? You don't need to waste 1 year to go and tell your doctor I tried for a year. You're not ovulating. You're not getting regular periods. The chances of getting pregnant are very, very low. And if you're 35 years old and you just got married and you want to have 4 kids, I think wasting 6 months is also very detrimental to someone who's over the age of 35. And you've got to start thinking about a lot of things way in advance.
Yeah. And so when you say 35, you're talking about when the woman is 35, right?
35. So, yes.
But specifically the woman 35, correct?
So these are recommendations and ages that have been put out there for the female.
Yeah.
For men, it's very different. So for those of people that are listening that are not aware, women are born with a number of eggs they have to the day that they die. And those eggs kind of just run out during menopause in the late 40s, early 50s for most women. But many of those eggs that remain are really non-functional and of very poor quality. Even around the ages of 40. I mean, I've had a woman in her early 30s whose egg quality was so poor, we had to find an egg donor for her. And I've also had a patient who used an egg donor spontaneously get pregnant on her own for her 4th kid. So we've seen it all. But men are very different. Men, we're all sitting here right now, and as we're sitting here, even Jeff is producing sperm.
That's a lot of them.
Sperm takes 72 to 90 days to come into this world, and we continue to do that to the day that we're alive.
So men don't lose their ability to produce sperm ever?
Well, I'm not going to say definitely the sperm production and the quality of sperm will go down. Studies have shown that after the age of 40, many men have decline in their sperm quality and in different parameters. And the sperm is linked to more abnormalities such as aneuploidy when the chromosome numbers are off. Right. There's some very loose evidence. I don't even want to call it evidence, speculative evidence that maybe there's a link with autism in older men.
Mm-hmm.
Having kids. Got it.
Oh, what are some other things that affect sperm quality?
Sperm quality can be affected by a lot of things. First of all,
Jeff's taking a tangent off the podcast.
Yes,
now this is personal.
How is that a tangent? I'm just trying to make sure no one gets pregnant. So I'm trying to.
This is what's called a free consultation. I find myself doing them on airplanes, like by the pool at a hotel.
I'm trying to adversely. It's the opposite. I'm trying to adversely affect my sperm count.
Continue. I apologize.
No problem. So let's give them this free consultation.
Okay. Thank you.
Genetics is probably the number one factor. Like there are just people that just have like poor genetics and just make poor quality sperm their whole life. However, if you are really exposing your body to a lot of excessive heat, steam rooms, jacuzzis, saunas, anything that gets your boys and your scrotum or your sac into a very warm environment for extended periods of time can be unhealthy. Lots of people think that tremendous amounts of exercise, but there are some things like spinning and cycling that too much of it is actually bad for a man.
Is it true that marijuana lowers your sperm count?
It can. So marijuana, right now there are like so many different components of marijuana that are out there. I'm really bad at this, but I can tell you it was really easy. Like 10 years ago, you'd go to the lectures, grand rounds, all the studies showed marijuana makes your sperm quality in many categories, whether it's the sperm count. The majority is affected to the sperm quality, which is called morphology, which looks at the head, the neck, the tail of the sperm. However, when you're looking at it now, like, I don't know, there are like some people like CBD and all these things like that could be good. That it's not out there yet. Right. So I'm just going to stick with my gut feeling that using any kind of recreational drug may not be good for fertility and be bad for sperm.
How about this one? Very important one for today.
Mm-hmm.
Does a COVID vaccine affect your sperm count, or can it make your testicles get swollen? Like
Nicki Minaj says so.
Nicki Minaj did say so.
I didn't hear her commenting on testicular size and the COVID vaccine, but I'm going to have to look that one up.
So just to refresh for anyone else who I didn't hear, about a week or two ago, Nicki Minaj famously talked about why she's not getting the vaccine yet because she's doing her research, and she had a cousin or a family member in the Caribbean who got the COVID vaccine, told his family that's why his balls swole up. His testicles got really swollen, and he's unable to have kids. And he said it was because of the COVID vaccine. And now she told this to her 50 million followers.
Very often, I don't talk about my personal life, but I did get 3 doses of COVID vaccinations and have not noticed that yet. There you go. I want to say that it's a myth. And the COVID vaccine, the American College of Obstetrics and Gynecology, just this week, after multiple emails kind of saying to everyone that it is a complete myth that the COVID vaccination affects your fertility currently or in the future, came out and actually said it's the doctor's obligation to make sure that your patients are aware that it is a complete myth. And, being active on social media, I have to tell you, I maybe got hundreds, if not thousands, of people from all over the world asking me that specific question, to the point that I think it's nonsense. And for all of the anti-vaxxers out there, I'd love to see some data about all the anti-vax ammunition that they have.
Because they'll send you a Facebook group.
I think this is super important, and I definitely wanted to make sure we touched on this today, because a lot of people, young people, use this as their excuse or as an excuse not to get the vaccine as well. This may affect my fertility one day. We're literally talking to the fertility expert, where people come from around the world to seek his advice on how to become fertile. And
how long did you go to school?
Too long. Definitely too long. I've calculated multiple times.
There were a lot of titles.
It was like 17 years, I think.
Yeah. Was your route to this through as an endocrinologist or OBGYN?
OBGYN. I used to run and do deliveries in the middle of the night.
Got it.
Wow.
I think I've done over 1,000 deliveries.
Wow.
I've done one in medical school.
Did you catch the
and
baby?
I did not drop the baby.
Nice. Congratulations.
Thank you.
One step closer to your own. So that's clarified then. There's no fertility issues. Let's go back to the men stuff. There's a rumor that if you wear tighty whities versus boxers, the positioning of your testicles closer to your body, the heat can make it lower sperm count. Is that a real thing?
Very accurate. So super tight underwear, extremely tight. I like to call them skinny jeans. The ones that are like basically like pantyhose. They're really bad. So anything that brings your testicles back closer to the inside of your body where they do not belong, it takes the temperature up. And anything that does that. So I like to tell men, like at nighttime, like I know a lot of guys that sleep in like basketball shorts, like 100% polyester, like put the balls on fire. It's just like that heat that you get from that polyester is just, so cotton shorts or cotton pajama pants, no man needs underwear at night. Just be free and live it up. But just like loose cotton is what everyone needs.
Yeah, we talked last week on an episode about this, how you should wear something, if not underwear, because there were studies that showed that you passively pass at least 10 to 15 farts a night, and so there's more fecal material in your bed if you don't wear something.
Can you please email me that study?
Yeah, we will.
So wear pajamas. So bottom line is pajamas are good.
Yeah, but no underwear.
No shorts, no underwear.
All right, cool.
A covering, I guess.
Yeah.
And make it breathable and make it non-sweaty. So that is absolutely true, by the way.
This sounds like a Cosmo Kramer Seinfeld episode.
He definitely doesn't wear it. Cosmo doesn't wear underwear.
Famously, he admitted it. Yeah.
Sure.
So why is there so much controversy with fertility issues in general? Like why, like Daisy Perkins, a very famous Instagram, social media actress star, opened up about her IVF journey and the shame surrounding infertility in general, feeling like a lot of shame gets put on women, a lot of pressure gets put on them. How do you navigate that with your patients who feel like it's their job as a woman to have a baby naturally?
I think we've come a really long way in the last probably 16 to 18 years of that I started my career. Initially, I feel like, no one would want to talk about this. And, growing up in this part of town and having people come in that I would socially see here and there, like, please, doctor, don't say hi to me. I don't want anyone to know I'm doing anything. But it's changed. I mean, it's really, really changed. Thank God for, forward thinking and being proactive in our country. And thank God for the women that have spoken openly about this to make it just one of those things that happens. Women are not starting at the age of 20, 22, 24 like our moms did. Right. They have careers that are more advanced than men. They're doing all the things that every single man has done, and now it's time to have a baby, and it's going to happen a little bit later. So unfortunately, the biology of a female and male are different, and that's what happens. Sadly, it is one of those things that women do feel that they're not complete if they want to have a child and cannot have a child. I think that men would feel the same. It's, maybe in a man's life, if like you didn't have a career and you tried your whole life, maybe you wouldn't feel complete there too. So it's just one of the things that I think everyone has an expectation. I do interviews and consultations with people around the world. I've had women from the other side of the world crying that if I don't help them have a baby, their husband and the husband's family is going to be removing her from the family, very soon.
Wow, yeah.
So I hear sad things like that all the time.
Yep.
Wow.
What's interesting, I've been watching that show, The Nick, that doctor show.
Oh, yeah.
From it's based in the year 1900.
Yeah. Right.
And they were saying at that time, the average age in 1900 was about 40 that people died.
Wow.
So if you think about it, life's changed so much because most people are just getting married in their 30s, mid 30s. Right. And so it's amazing that we have these types of technologies to allow people to do things, in the order they want to do them in, not feel rushed. And I think I agree with you so much that, freezing eggs is something I definitely want to talk about today too, which is something that takes so much pressure off women who are dating still, let's say in their 30s, that they don't feel they have to rush into a relationship.
Well, when is the ideal time to freeze your eggs? Let's say you're a woman who's in her young 30s right now. Is it too late?
Every single person is on their own timeline. When I give lectures, there's always this awful slide that pops up that starts to show the decline of female fertility, which begins between 26, 27, and 28 for most women. So even if you're still healthy and even if you're still doing well, about 26, 27, 28, your fertility starts to decline slowly. And as you get older, that slope of the decline starts to get a little bit steeper and steeper, and it starts to go down really fast. And many people know that 35 is an age. There's no switch that turns on the day you turn 35. However, it's fertility for women is declining their entire life and becomes significant in the late 20s. We have not been able to really convince that many women in their 20s to freeze their eggs. So I have had some that were really proactive and I don't want to have a kid for at least 10 years and I'm just starting law school and I'm just doing this and that and I know I'm not going to, and they've been excellent. The other women in their 20s that have done it are people that lost an ovary for an ovarian cyst or ovarian torsion or some reason or another. They're okay, I only have one ovary left. I better do something to safeguard in case something happens again. Yeah. But I think the general number that is becoming smarter and smarter rather than when the technology came out and everyone was running in here at 39 and a half before their 40th birthdays is 30. So lots of OBs in town, when a woman's hitting 30, you're kind of bringing it up to them. In every single discussion I've ever had on with anyone, I always bring up, at the age of 30, you need to check to see what's going on. If you are not imminently having a child, very soon, once you are 30, you need to think about fertility preservation. And generally speaking, most women in their 30s are still doing okay. Once in a blue moon, we have someone who's 30, 32, 33 call us to come and freeze an egg. And we check and I'm wow, she's already had a major decline in her fertility.
So take us through the actual Black Mirror moment of this. What does freezing an egg mean? Where does this physical egg live? And if the electricity goes out, does the egg die?
So yes, I don't know what part of Beverly Hills you're in, but yesterday the electricity went out for 30 minutes in our practice, and all on this side of Beverly Hills, the south side. The process of getting the eggs out involves usually about going on a little birth control for about a week or two to stop your natural ovulation. And then after that, we transition into these tiny little injections size, if not smaller than an insulin needle. They go into the belly. Our nursing team teaches patients how to do it. We have services that do it for you. You can come here every day, but it's usually about 2 or 3 little tiny injections that go into your belly for about 10 to 12 days. And during those 10 to 12 days, you're going to come to my office probably about 4 or 5 times to make sure that everything is growing well. And then we're going to say, you know what, it looks like your eggs are ready to come out. We have a surgery center that's right here and connected to my IVF lab, where my anesthesiology team gives about a little, very small amount of sedation. When you fall asleep, you're totally breathing on your own. There's a vaginal ultrasound that's placed with a little needle port at the tip of it, goes right through the vaginal wall into the ovary, and the needle is hollow, so it helps us suction out the eggs, and takes usually under 5 minutes. And the entire process of the eggs that we grew that month, not all the eggs in your body, because I want people to understand that not all the eggs in your body are coming out. It's just the eggs that were going to die off anyway that we were able to stimulate to come to life that month, rather than the one for ovulation. And then those eggs go to my IVF lab. They're looked at, and all of the mature eggs are then frozen and put into a special location in my building that I even don't know where it is. But it's under generator backup. For reasons of earthquakes, and welcome to California, there are seismically tied down tanks. The tanks are visualized and checked every single day by 2 members of my team, because everything we do is always double witnessed. And we have alarms, and we have every other thing and generator backup for all of that. So our clinic has done every single thing we can. We are extra careful. We've never put like this person's in that and that person in this. And we were never like sharing a dish when doing like 3 people's IVFs at one time. So those things, just don't happen here.
Good. You don't want that.
You don't want that.
And then the eggs are just sitting there waiting. They're waiting for you.
Do people sometimes have crazy requests where they want to choose which egg, or they want to decide, oh, well, this egg, can predict some sort of trait like brown eyes or taller or anything?
I've been getting that question a lot, because I think the media is throwing it out there that you can pick eye color and hair color.
I heard you can do that. I heard you can make him look like Brad Pitt now. That's not real?
I mean, just because you hear something, you guys, I think this is the topic here today. It doesn't mean it's true. No, you cannot. I mean, unless it's available in some crazy clinic that I am not aware of and I've never seen the research of, and nor has anyone talked about it in my industry, other than just like hearing it from lay people just, on a consult being like, I know you may get mad at me, but I want to ask you one question. Can I pick blue eyes for my kid? And the answer is no. It's not available that I'm aware of.
I thought I thought you could do genetic testing on them.
Yeah, that's a myth. That's a great myth buster today.
There you go.
So,
I'm busted.
I'm busted too.
You can do genetic testing on an embryo, but what it checks for is the 46 chromosomes.
Right.
To make sure something like Down syndrome is not present. And as a result of 46 chromosomes, the X and the Y are part of that. So you get to know if it's a male or female if you want to know. We can't make a male. We can't make a female. I've had patients yell at me because I didn't make the gender they wanted, but we can disclose to you what your embryos are, but you can't do more than that.
Right.
Wow.
And then what's the next step? So when you typically implant the embryos, are you implanting multiple or just one, or how does that work?
So how does the sperm get into the egg?
That's a really good question.
I skipped a step.
This is the natural way we all understand, but how does this work?
So basically, at that point, the egg freezing is done. If you are actually trying to have a baby, you have a partner, or you're using a sperm donor, or whatever, you have sperm available to you, we will then take the sperm, put it under the microscope after it goes through like a cleanup process, getting rid of all the bits and pieces and fluids and things that are completely unnecessary. So the sperm becomes as clean as possible. My embryologists then pick up a sperm. Actually, the picture right behind my head, which I know this is a podcast, but it's right there. It's a needle, picks up the best looking sperm. It's a hollow needle. And then that needle pokes right into the egg, releases that one sperm, and then we leave it, and then it has to do its own thing, which is called fertilization. You cannot force fertilization.
Wow. So we still can't force fertilization. All we can do is just put them together and allow them to do their thing.
You can find the best looking sperm you can find, put it into the egg, and then the next day you will have to see and observe if it fertilized or not.
Wow.
That's cool.
So there still has to be some nature involved no matter what.
There you go.
Wow. And then what is the process, and why do women have triplets sometimes by accident?
When, let's say, a woman makes let's just throw a number, 20 eggs. It's just like someone who's done very well in my office. We put, she has, let's say, like 16 of them are mature. Those 16 get injected with sperm. The next day we see, okay, well, 12 fertilized. We watch those 12 grow for a week. Any embryo that makes it to the full-grown stage, it's called the blastocyst. It's a full-grown stage before an embryo has to connect itself to the uterine wall and implant itself. Those embryos that grow completely, we can do a tiny little biopsy from the back section of the embryo, and then we freeze them. And within a week or two, I get a report that says embryo 1, normal female, embryo 2, normal male, embryo 3, Down syndrome, embryo 4, chromosomal abnormality. All the genetically normal ones then get frozen and saved in the same hidden location that they're hiding from me in this building. And then they're there for as long as you need. If you're actively trying to get pregnant, generally speaking, the next month, we do what's called a frozen embryo transfer. If you're doing that to save it for the future, it's then saved for the future. With all that being said, at that point, you know which ones are genetically normal versus the eggs you don't know. You just know which ones were mature, and you can't do the genetic testing, and you never know. Maybe the sperm in the future is going to be great, maybe it's going to be bad. So it's hard to say which one's going to make a normal embryo.
So the second freezing happens after you've fertilized the egg, then you freeze it again. And now it stays frozen for as long as they want. Again. So
if you freeze the egg's frozen. If you come back 10 years later, you thaw the egg and then you freeze it as an embryo.
Yeah.
But so that's 2 freezes. If you're going through this whole thing all at once, it's just 1 freeze at the stage of the embryo. We don't freeze it and then the next day thaw it.
And I think an important point here is that that's normal, that when you take a subset of eggs, that some of them are going to have chromosomal abnormalities or be abnormal. And on a normal cycle for a woman, they're just going to experience that as a normal period or something, right? Because things didn't implant well. And so in a older couple, those sorts of abnormalities are probably why they're not getting pregnant up till the time they see you, because you're picking out the ones that actually are not having a problem.
Yes, you said it very well. And those, even when we use like a 22-year-old egg donor, she still makes abnormal embryos.
Right.
Not as many as a 42-year-old woman, but definitely it's been very rare to have someone that's never made an abnormal embryo in my office. And to answer your question, why do people, end up with triplets? A lot of clinics that are not that good usually put a lot of embryos in, just hoping that one is going to make it. Our success rate for just one genetically normal embryo, as long as we have one, is between 76 to 84% going to birth. So that is a very, very high rate of implantation. And for that reason, we never put more than 2 in, and we only put 2 embryos in those people that are really trying to go for twins, because the rate of both of them taking is very high.
Wow. Very interesting. And has that success rate gone up over the years because of technique or because of this, or is it just because you have magic hands?
I like to think I have magic hands, but unfortunately, it's the technology has really, since I started, probably doubled. Our rate of pregnancy was probably in the 40 to 50%, like 16, 17, 18 years ago. And now we've done much better. But we also have, I think, an incredibly proactive lab director who runs my lab. He's a PhD and he's brilliant. And he is incredible with everything we do. And we do everything. We do everything from air filtration system. It's like a multi-million-dollar filtration system to like heated countertops that are at the same temperature as body temperature, to no UV light.
Interesting.
Wow.
So every little thing that we could do, we've done it, and all these things little by little by little really add up to have excellent success.
So and you're really similar to a plastic surgeon in a lot of ways, a lot of the conversation we're having today, because like a lot of the things you're saying, I'm like, oh yeah, that happens to me too. Like when you were like, when I go out in public and your patients are like, don't talk to me. That's like a plastic surgeon in Beverly Hills. That's all of us.
See, my patients are allowed to talk to me in public.
Yeah.
So I know the problem is the opposite way. I do want to talk to them. They don't want to talk to me in public.
That's exactly what a plastic surgeon is. Yeah, same exact.
I get what you're saying.
Yeah, because they don't want to admit they got their nose job.
Well, you know what? I got to tell you though, it's changed a lot. Like I was at the mall not too long ago, like before the pandemic hit, with my wife, and like across this store came some woman screaming, "Your husband got me pregnant!" And like people were like looking, and at this, like, for 1 second, I'm like, "What?" And then I realized it was one of my patients immediately. So It's
That's a
gotten
good
much better, and people aren't really hiding like that
That's a good
anymore.
title for the episode.
I agree.
Your
Your husband got me pregnant.
That's a great line. Okay, so just to circle back to this thing about the twins and the trip, because I remember, like 10 years ago, famously that Octomom, where she had like 8 kids and they're twin.
So that was like the strip mall fertility doctor.
In those old days, why? Because when you are saying you're implanting 2, and they may have twins, those are going to be genetically distinct twins. So they're going to be fraternal twins. They're not going to be identical twins.
So you never make identical.
You can't make identical. So
identical how does that happen from
1% of natural conceived pregnancies at home and 1% of conceptions in my laboratory turn out to become identical twins that split on their own. There is nothing we can do to make an identical twin.
Cool.
Got it. Okay.
Very
Understood.
cool.
And talking about Octomom's doctor, actually, the doctor was a reputable doctor about 2 blocks away from me in Beverly Hills, a nice man that I know very well.
Yeah.
I think it was, and I know a little bit more about the case. Some clinics actually put more embryos in because maybe they're not the best lab and they know it. And there's some people that, have not done genetic testing on their embryos. So we know a few are going to be bad there and not take there. And I think there was an agreement from this woman that she was supposed to come back. And if more than 2 took, she was supposed to do this procedure called selective reduction, where they go in and they kind of inject the sac where that fetus is. And she never went back. I'm not saying that it was good medicine or a good choice from anyone to put 6 and 2 of them split and made 8. But at the same time, I think there's a lot more involved to that than
carrying 6 babies even seems like a lot.
Yeah, that's very intense.
Carrying 2 babies is a lot.
So here's another question. So obviously I'm an internist. I'm not a gynecologist, but I have a lot of patients who a lot of times ask me, let's say they're in their late 20s, early 30s, women who are asking about some of these same questions, pregnancy, et cetera. I've been recently advising some people that age to get off. I don't know if you agree with this, but to consider going off of their birth control if they've been on it for 10 years or more to just see if their cycle is normal or not. Because, how are they supposed to know if their cycle is normal if they've been on birth control for a very long period of time?
Well, you can't know if your cycle is normal because if you're on birth control, you're going to have normal cycles.
Exactly.
If you start giving your grandma birth control pills at the end of the month, she's going to have a period and she's going to go back again in the next month of a period. So anyone on birth control, except for the 3 of us, cannot have a period at the end of the month. Okay.
Right.
However, in order to assess your fertility, women get very confused that their fertility, I have a lot of patients that are like, I used to bleed a lot. Now I'm bleeding very little. I'm so concerned. There's not much of a correlation between the amount of blood that comes out of your uterus and your fertility. So that really is not a good correlation at all. We do have a blood test, which is called the AMH, anti-Mullerian hormone, not malaria, but Mullerian hormone, that you can do at any time for a woman. They can be on birth control. They could be on birth control for 10 years. They used to say it doesn't affect it at all. But now we know that if you've been on birth control for 10 years and you do the test and it's really low, that maybe if you went off for a month or 2, you could then do a more accurate one. But if your fertility level with your AMH looks good, you're doing really well. And you can be on birth control. So you don't really have to come off birth control. Some people, physicians give advice that if you're going to go see Dr. Ghadir or a fertility specialist, maybe come off birth control for a month or 2 before. Because we do think that right before doing the fertility treatments to freeze eggs or do anything, being off the birth control for a little bit will help you.
Very interesting. I like it. I mean, you are a wealth of knowledge. So now because of that, we're going to put you to the test. So we're going to do what we can. This is our TikTok myth busting section now. Okay, Dr. Ghadir, you're going to pass this. Don't worry.
As long as I don't have to do a TikTok dance, I'm going to be fine.
There's no dancing at all.
Yeah, Jeff refuses to dance. Only anything that has to do with his hair he's happy with. So number 1, I've had a lot of Taco Bell in my life, a TikToker says. Taco Bell famously has this weird label where it says reproductive harm on it. Can Taco Bell reduce your chance of getting pregnant? or cause any fertility problems or reproductive harm?
I'm going to say yes, but I'll explain why. If you eat a lot of Taco Bell and you start to gain a lot of weight and you become overweight and your BMI goes up and you become obese, weight and fertility have a lot to do with each other. So we know for a fact that as women gain weight, sometimes they start having features of polycystic ovary syndrome, irregular periods, lack of normal ovulation. And in that way, yes. But I think for like someone who just loves to have like a cheesy bean burrito once every couple of months from there, I don't think you're going to be harming your fertility.
Love it.
As long as you don't put the hot burrito, you know where.
Yeah.
Not that hot burrito.
That joke is why Jeff has no kids.
We figured it out.
There you go.
Well, the studies are saying, so what it is that there's a chemical called acrylamide that is in many fried and baked foods. In the state of California, it's on their list of potential chemicals that can cause cancer or birth defects, which, as we all know,
at Starbucks too.
That list is extremely long. Yeah. But I agree with Dr. Ghadir. If you don't overdo anything, it's probably okay.
But why would they put a chemical like that in their food? I mean, I know their food's not real food, and I've seen it come out of like packages that came from like China. But I don't know. It's like
I think you just answered the question. It keeps it
all right,
stable at room temperature for
years. Yeah. So the next one. All right, there is a TikTok IUD removal trend where girls are empowering themselves by removing their own IUDs. They are taking videos, literally pulling out their own IUDs, and literally one person, as she posted her video, joked with her Mirena IUD in her hand, calling it the catch of the day. Is this a good trend or bad trend? Should kids do this?
God, you guys, wow.
These are real stories, by the way.
This interview has been very unique, by the way. Never. The visual of, is this placed on TikTok? Like, is he showing the process? Or like, is it like...
There's literally a video and people are saying that she's empowering herself.
I do not think that people should attempt to take out their own IUD. Okay. Because if you pull the IUD out partially in a crooked way, and then it gets stuck, and you hit a blood vessel in your cervix that causes a lot of bleeding, you're going to be in trouble when your internist doesn't know what to do. Okay,
I differ.
So, like, I just think it's like, if there's no way to put it in without a gynecologist, so I think that it's probably much better left for your OBGYN to remove very quickly. And a lot of OBGYNs actually like to send them off for cultures afterwards to make sure that there's no overgrowth of bacteria on them.
And can we just hit one serious note quickly on this? Some women are often worried that putting in an IUD will affect their fertility later. What's your thought on that?
So in the older days, I can't believe we can say that now, but I can. In the older days when
in the 1900s, you mean?
Like in the 1980s, or like in the so if you were very promiscuous and had a high chance of getting chlamydia, gonorrhea, or any kind of PID, pelvic inflammatory disease that could cause infection, having an IUD in place could also cause scarring and damage to the lining of your uterus that could affect your overall fertility. If you're in a monogamous marriage, I don't think there's any harm and any fear that an IUD in any way can cause infection, scarring, or damage to the lining of your uterus.
Good.
Fair. Yeah, great. Great question.
It's very effective.
Well, here's another one. Men are claiming that a positive home pregnancy test in men can potentially show a risk of testicular cancer. A viral Facebook video is urging men to get tested using female home pregnancy tests. Just pee on it and it'll let you know if you potentially have a risk of testicular cancer.
So I'm not sure if it's going to give you a risk factor. However, there are some cancers that do have HCG hormone as their potential blood test that, like breast
You're
cancer.
a real doctor. He's a real doctor.
I think testicular cancers secrete alpha fetoprotein. I don't know if that's would be something that's on a pregnancy
the
test.
only hormone that a home pregnancy test is going to be looking for is human chorionic gonadotropin, HCG.
Yeah.
And it has to be an HCG usually of at least 20 or higher, and a patient's negative pregnancy is under 5. And there are some, I can't remember which cancers secrete HCG. It could be the testicular one. I'm not sure.
Can. Yeah, they can.
They can. So then the answer is actually yes then.
Wow.
Yeah.
But you said
Interesting.
as a precursor, I don't think it can work as a precursor. Like you can't pee and it turns positive, meaning like I may get testicular cancer in 20 years. I think it's one of those things that's either in you or not.
Right. So yeah, so like you guys said, it's testing the HCG, but generally speaking, you're not recommending all men go out and pee on a stick.
No, I think you're better off going to your urologist.
Perfect. These are all real.
These are really good questions, and I need to know where you guys find these.
We have a really good
we have a good
TikToker gives us our info.
We have a good employee.
Well, I have 2 more we have to hit, because one of these I just want to know, is this even possible? A teenager went back to 11th grade and delivered a baby the day before school, claiming she didn't know she was pregnant. Is that physically possible? She was obviously morbidly obese, but is that actually possible?
Yeah. So, I mean, I think I saw a Discovery Show channel special on this when women were delivering that had absolutely no idea. So younger girls have very irregular periods, and sometimes their periods don't come for a while. Again, going back to the whole weight issue, women that are morbidly obese actually have very irregular periods. So she may have gotten a period and not realized. Lots of morbidly obese patients do not gain that much weight during pregnancy because a lot of what's needed for fetal growth comes from all of the extra surplus in the body. And if if you are very large, there's a chance you may not notice your stomach growing. I think that 100% can be true.
Wow. That's great.
You don't feel the kicking?
Yeah, I'm amazed.
Yeah. I mean, this is, I saw a show and there was so many people that this has happened to before. It was shocking.
Well, I'm very, very amazed. And you definitely passed our TikTok segment.
There you
So
go.
thank you so much.
Appreciate it.
You are definitely a real doctor. Well, this is amazing. This is such a good episode. I really think it was really helpful. I've never actually visualized the concept of how to freeze an egg and what you do with it. And I'm very comforted that you have a backup generator. And so basically, what happens if you go out of business one day or you quit? You get too wealthy and retire. Where do the eggs go?
The latter probably will never happen, but the other scenarios may. So what happens is that we have had physicians that went into retirement and their own labs. Their embryos were shipped over here. It's before the days of egg freezing. None of us have left, and our practice isn't going anywhere. So if I leave, the practice will still be here. We just hired a brand new doctor that works for us, and maybe she'll be, using those embryos in the future. So for her patients, so they're not going to go anywhere unless you sign paperwork, and there's a lot involved. We do not discard anyone's eggs or embryos or sperm.
Awesome.
Wow.
So if someone's listening to the show and they want to hear more of your content or see you as a patient, how is best to find you?
So on Instagram, Dr. Shahin Ghadir is the easiest way. It has all of my links to my podcast, which is called The Fertile Life. And guess who's going to be the next few guests on my show? And also, I have a YouTube channel as well. The clinic is called Southern California Reproductive Center. We're located in the heart of Beverly Hills on Roxbury Drive, and we're happy to help anyone. The one thing I do want to give a plug to is our clinic does do webinars about 1 to 2 a month. They used to all be here in an auditorium in my building, but now it's easy. I have people from all over the world watching because they're all virtual and online, and they do go to our YouTube channel. So if you don't catch it then, you can catch it later. But they're free, and you also get a discount code for using for your consultation if you've watched it.
Wow, very cool. That is really cool and a great resource and a great way patients who aren't sure about doing a consult can just learn more. So that's really kind of you guys to do. Wonderful.
Thanks for coming on. Appreciate it.
Thank you guys so much. It was a lot of fun.
Thank you, doctor. All right. Well, that was great.
That was great. I think we all know how to get pregnant now. And
got some homework.
Hopefully some people know how not to get pregnant.
Yeah. We did not talk about that. But safe sex is still very important. Please wear condoms and please be very cognizant that STDs are real and still around. So be very careful.
they're still there, still having people test positive. Just because COVID's there doesn't take away
all the other stuff.
I think STDs probably did go down for a little while at the beginning of the pandemic.
Right.
When people were like scared,
physically unable to. Yeah.
Locked down.
Right.
It's probably a boom right now.
Having sex with masks. I can imagine it got weird.
Yeah. But now it could be an STD boom. This is probably interesting.
Yeah, you'll find out. Your practice, you probably have patients who come in with these kind of issues once in a while.
Could be.
Yeah. Well, safe sex. And if you're trying to have a baby, please send this to your friends and family who potentially need to learn more, because I learned a lot. This is actually very informative for me.
That's fantastic.
Yeah.
Thanks for listening.
Thanks, guys. Continue to listen. Great episodes coming up.